Welcome to the Chaos Whispers of Healthcare, the podcast for busy healthcare leaders who are ready to get out of survival mode so they can focus on what matters most. This is where the burnout stops and the real talk starts. I'm your host, Dr. Megan Carter, and each week I sit down with healthcare innovators who get it. We will unpack the chaos, laugh through the hard stuff, and get you at least 2 practical tips you can use at work right away. If you're ready to clear the chaos and lead with impact, you've come to the right place. Let's jump in. Welcome to the very first episode of the Chaos Whispers of Healthcare. I'm Dr. Megan Carter, a recovering healthcare leader, a mom, a former hospital executive, and current entrepreneur. If you're listening today, chances are you're carrying more weight than any leader should have to. I'm guessing you know what it feels like to be completely overwhelmed. The kind of overwhelmed where even writing a to-do list feels like too much. Staffing crises, financial pressure, email inboxes that seem to grow overnight. Healthcare leadership today isn't just a job. It can feel like an extreme sport. I know because I've lived it. I spent years running faster, juggling more, thinking if I just worked harder, maybe things would get easier. But they didn't, because that's not how healthcare works. And eventually I realized we cannot outwork a broken system, but we can lead differently inside it. That's why I started this podcast and why I believe we need chaos whisperers now more than ever. Chaos whisperers are healthcare leaders who are done with the burnout and overwhelm. Innovators who know how to clear the noise, protect their energy, and lead with real impact, even when the environment is messy. Each week, you're going to meet innovative leaders who are doing just that. And here's my promise to you. You will walk away with at least 2 practical strategies you can use instantly in your work week. So if you're a healthcare leader who's ready to get out of survival mode and start leading differently, you're in the right place. This introductory episode is brief, but helpful to start with as we walk this path together. I'm going to share a bit of my story so that you know you're not alone. The fact is that the U.S. healthcare system is broken. We are the most expensive place in the world to receive healthcare, yet many of our clinical outcomes are inexcusable. Just look up our maternal mortality rates, for example. While there are several complex reasons for this current state, it is my belief that focusing on the people who lead and provide care in the system are the key to healing it. My life's mission now is to elevate the brilliant healthcare leaders and their clinicians to leverage their expertise and focus on what matters most, their people, and those precious patients they serve. But in order to do that well, we must acknowledge where they are at right now. A majority of leaders in the U.S. healthcare system are at the very bottom of Maslow's hierarchy. They're stuck in survival mode. Not because they lack skill or intent, but because no one shows us how to go from surviving to thriving in a practical way. Think of the meeting madness you deal with every day, or the constant texts and calls from a team lead about today's fresh crisis like a water main break. The 2025 Nurse Leader Insight Survey from AONL and the 2025 Healthcare Workforce Scan from the AHA both reveal parallel realities. The U.S. healthcare workforce is not sufficient to meet current or projected patient acuity or volume. The workforce and staffing are consistently ranked as the number one challenge leaders face. And when you can't even get a few minutes to engage in those critical retention strategies, it's enough to make even the most veteran healthcare leader scream. But here's the good news. We can and must evolve because people will always need healthcare. We as leaders will need healthcare, and we can do better. Unlike other healthcare leaders, I do not have a romantic story about why I chose nursing. I was actually on a different educational path in undergrad. I was convinced I wanted to be a molecular biologist. I don't remember why I searched for nursing programs, but I did. So I like to say that nursing found me. I fell in love instantly. Easing human suffering directly as a clinician lit me up inside. I felt like I was home. It was not easy or predictable work, but I loved the chaos. I loved managing emergencies so much that my team started calling me Crash Carter. Early in my career, I was very anti-establishment. I viewed the healthcare leaders as people who had other priorities than patient care. I was so ignorant of what they were dealing with. Fast forward several years, I went from charge nurse to educator, then to supervisor, nurse manager, director, and associate chief nursing officer. Halfway through my executive leadership DNP program, the pandemic hit, and I was simultaneously moving my family cross-country for the ACNO opportunity of a lifetime. 17 years of progressive leadership left me so incredibly unhealthy that in August of 23, I took a 6-month sabbatical. When that was over, I had a choice to make. Instead of going back into the workforce as an operational leader, I felt called to start my own company and share real-world solutions with other healthcare leaders who were feeling the weight of it all like I was. So the Chaos Whisper movement was born. At my company, MC Healthcare Consulting, I spend my time addressing real-world pain points like meeting madness and leader calendars that look like a game of Tetris. And if you're too young to know that reference, imagine being triple booked every hour of every day. One of my most popular tools is called calendar triage. Like the name says, it uses triage methodology to quickly scan your calendar for the work week and help you decide which meetings are value added, which ones are not, and how to create pockets of protected time for those retention strategies in the face of a shrinking workforce. And that's a free tool you can get from my company website right now. Here's a true story about why I chose calendar triage as one of my first tools. Tell me if this sounds familiar. I was once asked to take on 2 additional large service lines due to a reduction in force in the leadership team. This organization was desperately trying to salvage its op margin, and through that lens, they decided to eliminate some leadership roles to save on salary. So those of us who survived that round of layoffs were asked to take the work left behind. Being the person that I was, I said yes and convinced myself it was a great growth opportunity. It absolutely was, but it was also eye-opening. My calendar filled up overnight. On any given day, I needed to run between committee meetings, board presentations, disease-specific accreditation updates, and responding to clinical unit crises. I had around 800 employees in my scope, so I tried to be everything to everyone. Does that sound similar to your experience by chance? I quickly recognized that I needed to shift my strategy, so I triaged my calendar. I objectively evaluated which meetings truly needed my presence and which ones didn't. I communicated professionally with the meeting organizers for the ones I declined. I created pockets of protected time every week so I could be present in any of my 12 departments. I started streamlining the meetings that I had left that I needed to attend or lead. And after about 6 months of this new practice, things had shifted. The many service line physicians trusted me. And if you work with any of our country's incredible physicians, you know that trust is hard earned. They made time to show up to my meetings because they knew we would stick to the agenda, drive action in between, and they would be heard. The clinical managers that reported up to me had the highest employee satisfaction scores in the building. I felt like I was thriving. This was the birth of what I now call chaos whispering. Fast forward a few years into my hospital executive role at a different organization, and those skills served me well. I had time to celebrate department wins, to round and engage with my teams. It was magic. And although the pandemic flipped us all on our heads, the need for simplifying our work week continues to be a priority. And now I share these tools, tips, and tricks with healthcare leaders across the country through my company's services. This podcast builds on all of those supportive best practices by bringing in experts from all over our industry. Because in reality, every healthcare leader has their own version of chaos whispering. We should be sharing our best kept secrets about how to go from surviving to thriving with each other. We are in this crazy broken system together, and people are depending on us to do what's right. So this is the essence of this podcast, friends. to remind you that you are so not alone. You will hear real talk about the real pain points we see every day, but maybe don't talk about. Listeners will feel like they're sitting at a happy hour or a cafe with us, except we also give you super practical strategies to thrive at work. I am so incredibly grateful to have you on this journey, and here's what you can expect in this first season. How to recognize and manage leader burnout, the rapidly evolving landscape of AI in healthcare, and how you can optimize your world with it. Workforce recruitment, retention, and care model strategies. Workplace violence, legislative advocacy, time management hacks, and so much more. Make sure you don't miss any of the episodes by following this podcast on your favorite platform so you can be the first to know when a new one drops. If you love what you hear, remember to rate and review as well, or better yet, share this with your colleagues. Thank you for all that you're doing at work. Your teams and their patients are looking to you, and that's a sacred calling. Cheers to you, Chaos Whisperer. Thanks for joining us on the Chaos Whispers of Healthcare. If today's episode resonated with you, please be sure to follow this podcast, rate, and leave a review on your favorite platform. I'm Dr. Megan Carter, and I will be back next week with more real talk, fresh strategies, and guests who are redefining what it means to lead with impact. Want to keep the conversation going? Be sure to connect with me on LinkedIn and download free tools and resources from my website. Both links are in the show notes. Let's heal this broken healthcare system together, one day at a time.